keep him safe and all others safe. And I also pray that God will strengthen his family as they go through this difficult period. For we, the living, including his family, we need to realize that COVID-19 is real. And in talking about COVID-19 being real, I mean it. There are still people out there who are in denial. And if anyone ever had cause to doubt what Kubler-Ross described as the stages of accepting difficult situations, when he included denial in it, COVID-19 has been a practical manifestation of that. There are people who are still in denial. And so sometimes when you even see the massing up of people and all, it may not just be because they are not law-abiding, but it's because deep within their recesses, their subconscious, they simply don't believe, that the disease is real. And some are even educated. There are some who also even feel invincible. Just a virus. I can only pray that the good Lord will touch their hearts and their minds so that they will have a total change of heart and absolute purification of minds and perceptions about what this virus can do and what it is doing, so that they can stick to the well-tested WHO protocols of hand washing with soap and the running water. And let me commend you, Multimedia. I've been here, this is my third time for these COVID-19 discussions, and you are always even enhancing what you have out there for hand washing with soap and all. Let's all wash our hands as frequently as possible with soap and the running water. If that is not available, let's use hand sanitizers. And I mean alcohol-based hand sanitizers. Let me draw a distinction here. It is not just important to see an alcohol-based hand sanitizer that has the inscription kills 99.9% germs, viruses and bacteria. Anyone can produce anything and say kills 99.99% germs. Also be interested in the percentage of alcohol that is in that sanitizer. And so I believe that if you go the next step of knowing what is the actual percentage of alcohol and you satisfy yourself that it is above 60%, then you know that, at least if I use it, I'm safe. Then I also believe that if the FDA continues to do their monitoring and surveillance very well, they will be able to rid the system of fake sanitizers and fake products that may also be worrying you and I. Last but not least is physical distancing and social distancing. Absolutely important. And let me welcome you, even though we look like prisoners in ourselves. We are all in our silos. You are the great preachers of not thinking in silos, but on this occasion
we must live in silos.
We must live in silos. More like that. So there's a need to ensure that. And this is where I also appeal to bosses, CEOs, managers of institutions, of departments. Even though the lockdown has been lifted, if you don't really need the full complement of your staff to be present, ensure flexibility. Ensure flexibility. Some of them can be away and can be working from home. If you don't need the full complement, some of them can be away, they can be working from home. Whilst those that you really need on the ground can be there. And they can run shifts. With that kind of flexibility, you'll be able to adapt to office space that had not been created in a way that will suit the social distancing and physical distancing that we are preaching today. And then regarding enforcement of the laws, I will expect that our law enforcement agencies are up and doing, and it should be without fear or favor. It should also go in tandem with public education, massive public education in a language that people understand, because if you are engaged in public education and it's in a language that they do not really appreciate, it's as good as not doing anything.
Yeah. Well, I'd almost forgotten how comprehensive your opening remarks could be. But this is life-saving information, so I'm glad that you've put it all out there. Very important, very important. Thank you for that. And it's part of the reason why I'm excited you're with us today, because beyond your experience in government and so forth, you are a medical doctor. So we know we're going to learn quite a bit from you today. I'm grateful for that. So look, let's get cracking. You talked about...
But could you,
yes.
Crack, let me, maybe it's... let me say it. I mean,
okay.
I'm not noted for timidity. I commend you for one thing. And what is it? You had challenges. And you stepped back within the multimedia space and did other things which in organizational management system others may see as a demotion, permit my saying. You stuck to it, did it with joy, ecstasy and everything, and you are back here. It's a clear demonstration of what one can achieve. It shows that a comeback is possible and that we just have to accept things that happen to us, even if they are bitter, and that you will never know. If you accept them very well and work at the issues that are raised, you can always rise from wherever you fail. So on that note, I commend you for it. I also hope and pray that all the lessons that you've learned over the period will come to play so that your listeners at the end of the day will be better served, and our dear nation will also benefit from the wisdom that will be generated from the ideas that will flow from the Super Morning Show on Joy.
It's very kind of you to say so, and we hope to keep improving. Thank you so much for that. All right then, so let's get into it. And you said something important earlier. You talked about the fact that some people feel invincible. Now, some of that invincibility comes from just a lack of information, but some of it also comes from the information, and I'll explain. We seem to have a surprisingly low mortality rate so far. It's hard to explain. I mean, yeah, the thing is spreading just as fast as it spreads in other countries. People are getting infected at a very high rate. But we have so few deaths, thank God. Why though? What do you think is the reason why it's not knocking people out as much here as it has elsewhere?
Okay. Let me take it from the simple leg first. You know, we have a very young population. If you look at the population pyramid of Ghana, you realize that those up to about 35 are very broad. Yes. So we have a broad base and a very narrow apex. Simply put, we have more younger people in Ghana than we have elsewhere.
I think almost 60%.
You have lived in the UK for quite some time now, and you will agree with me that on the streets of London, even if you move to Ireland, Edinburgh, even in New York, in Rome, the kind of aged people that you see on the streets, how many times do you find them on the streets of Accra? And everyone listening to us, look around you through your vehicles, your homes, and all. Check how many people are in that upper extremes of age. So you can say that because of our young population, we are able to withstand the disease better.
Right.
That is one. Two, you can also look at it from the way, and this may sound a bit technical, I'll simplify it.
Right.
The way the virus enters the cell, that is the cells that make up our body.
Yeah.
If I'm to extrapolate, okay, and the disease is very young now, so knowledge has still not crystallized. But if I'm to extrapolate, it is said that in treating hypertension in this part of the world, and even in the colored race, when you use the ACE inhibitors, like the antihypertensive that ends with PER, like lisinopril and those ones, or ACE receptor blockers, the antihypertensive that end with TAN, losartan, valsartan, and those things, it is not as effective in us as it is in the Caucasians. Okay. We are finding this ACE, there's no need to mention the full name, playing a part at the point where the virus enters the system. So who knows? At the end of the day, when studies crystallize, some of these will be seen as the factors.
Right.
But it shouldn't give us cause, and this is more important than the things that I've said. It shouldn't give us cause to say that, hooray, we are in good stead. This is because our health systems are not as robust and strong, resilient, adaptable as that of the countries that I have mentioned. And you can imagine if, God forbid, it should never happen to us, if we have 50 or 100 cases that require emergency care and that require ventilators that will be dedicated to them. Let's not forget, we cannot also assign all the ventilators in the country to COVID-19 patients who need them. So, whilst we are at it and looking at all these, we need to plan. And if you also look at the trajectory, our numbers are rising. Unfortunately, the curve, the graph that we see, is not too helpful in terms of predicting whether we are dropping. In terms of dropping, we know we are not dropping, we are rising. But plateau, because there was a point that the graph had shown a certain horizontalness, which elsewhere they would have said, oh, we are plateauing, so it looks as if.
But then we started rising again.
It's because of the inherent challenges in the way our testing system is being managed. So, at best, you can put the overall effect of the stepladder graph that we are seeing together and say that, look, the cases are increasing. So, even if the mortalities are low here, even if the number of cases that are developing the crisis are lower than the expected percentage, the rise will definitely impact on the total number that will need emergency care. And because of our peculiar situation of having just 67 ventilators within the entire public system, minus the private sector, and maybe if the 20 that a government said
they've ordered,
they ordered are in, then maybe we have 87.
Right.
So you can imagine what will happen. It is not just also about ventilators. When you're looking at health systems, it's an overall thing. It's about infrastructure, it's about the equipment, and most importantly, also about the human resource.
Yes.
Do we have enough anesthetists? The kind of Professor Dujemfi, Dr. Chris Owu, Dr. Cornelia Kwaku, Pum, and several others who can really, on the spur of the moment, take charge and respond to the needs of such critically ill patients. Do we have enough respiratory physicians like Dr. Audrey Forson and a few others to take charge and respond to this? Perhaps we should also be looking at quickly shifting some physicians in training, or even some who have completed their training, and giving them crash courses in emergency medicine, awaiting
the arrival of more ventilators.
A remote possibility, which we all do not pray for.
Right.
So I say that the numbers in terms of deaths are lower compared to the cases that have been confirmed, but because our trajectory is on an upward trend, we need to be careful and not just relax.
Doc, why are the recoveries also so low?
The recoveries, we need to also compare carefully. Unfortunately, but that is what can happen. The standards that are being used vary. So if you decide that in terms of recovery, you are not going to use additional tests, and if those additional tests are negative, then you conclude that the person has recovered. But you are going to use symptoms abating and the person being determined as cured at the end of 28 days, at the end of 21 days and all. One may be recording higher recoveries, another may be recording lower recoveries. Let me cite an example. South Korea has recently realized that what they mistook for reinfection was rather fragments of the virus that the PCR had picked in those cases, and so they felt they had been cured. They went back into the community and got reinfected. You understand? So these can obliterate the numbers. Be that as it may, there are still human beings to these numbers, and that is the most important thing. Whether low or high, one death is important because it is a father, it is a mother, it is a child, it is a chief, it is a queen mother, a teacher, a doctor, a lawyer, a journalist, a farmer who may be dead. So we need to do everything possible to ensure that we improve on the recovery, but it also depends on the kind of testing that is being used. I'm particularly not more interested in the numbers at this stage, particularly as we have not been able to marshal the needed resources to be testing en masse as we should be. But if in terms of recovery and the standard that we have adopted, that is what we are going to use to say that this person has recovered or not. It is low, but we should continue working on it.
Okay.
Let me stretch this to an appeal, and this appeal goes to community leaders. This is because, Kojo, if you test a patient as positive, and the patient is able to let you know that, oh, I live in this community, I met this person, I went to that house, I visited family ABC, and contact tracing is being done. When they get there, community entry techniques are very, very useful. And you need leaders in the community to be able to help you. Because once we lost the opportunity to contain the disease at the level that we should have contained it, and we saw the spread into communities, the horizontal spread. Now the disease is owned by the community.
Right.
That ownership means that the management of it must also include the community. And this is where I think government has not done too well in terms of bringing on board community leaders, assemblymen and women to assist in this. And perhaps we lost an opportunity during the distribution of food and other relief items during the lockdown phase.
We could have got them organized at that time.
If they had been included in the distribution of food and all, they may have also gathered a lot more social capital within the communities that, even when we were hungry, it was this Woolome, it was this chief, it was this assemblyman who, together with government, brought us food. So let's listen to him when he says that we should subject ourselves to the team that is coming around to test us and all.
But my understanding was that's what government did. That was the process they described to us, that they were going to use community leaders to distribute these things. Unfortunately, and we read a lot and also saw clips. Unfortunately, that intention did not translate into practical application. And that was a failure that I think they had to address. They didn't address it, but we still need the community leaders. And so let's not give up, because when the disease is in the community, it must be owned by the community, and that ownership means that we need them to manage it. Right.
Because, Kojo, if you are going to allow your relative to go into the hands of government for, let's say, 2 weeks, it has all kinds of connotations. And the person, even if cleared afterwards, returning to that same community also faces stigmatization and all. And so we need a community-based approach to this. Like I said, we lost the opportunity to contain it, and we have seen massive horizontal spread, community spread. That means that the traditional leaders, the assemblymen, youth leaders, influential people should be brought on board to assist the gallant men and women who are working day and night to ensure the safety of everyone.
Right. Okay, now we're talking to Dr. Edward Omane Boamah. You know him. He used to be the communications minister here in Ghana under President John Dramani Mahama. Of course, he's a medical doctor. He's got quite a lot of experience with the management of infectious disease, particularly going back to Ebola, when you were the chair, weren't you?
No,
of the,
for very good reasons and all my other schedules. Victor Bampo was the chair.
Right.
I provided a lot of support.
That's right.
And I remember even when Tony Bambry came in, he was the representative of Ban Ki-moon at the time, the leader of the UNMIR, the United Nations Mission Ebola Emergency Response. When
they came to set up the hub.
Yep. And Tony Bambry had to be oriented in terms of how to explain what they were going to do in Ghana and for the Ebola afflicted countries. Because at that time we had all kinds of caustic noises that were being made around as if President Mahama was importing Ebola into the country. But at that time, President Mahama saw it as, look, even if this disease will enter our shores, there is wisdom in having the army headquarters here. And all the protocols also that went with ensuring that we didn't have the disease on our shores were thoroughly implemented. I remember even the case that traveled through the airport, Kotoka International Airport. As early as that time, contact tracing forms had been made available. So all the people who were on that flight in that cabin with that gentleman
from Liberia,
who went to Nigeria, they were contacted and appropriate public health measures put in place. So I would say that there are also some opportunities that we lost at the beginning of this whole pandemic, but we should move on and learn from the lessons of not working excessively and on time to ensure that we held the virus at bay.
I actually wanted to ask you about that because indeed there was quite a lag, between the first discovery of Ebola and Ghana's sort of mobilization. I know that it was actually in December 2013 that the first case was discovered in Guinea. And then it started traveling across the continent. We had it in Liberia, in Sierra Leone, in Mali, eventually in Nigeria after that gentleman came through Ghana, on a plane that came through Ghana. Nigeria had it in July, but Ghana didn't issue a plan until August. And then it was I think it was in October, is it September or October, that the UN hub was set up. But we didn't see, in fact, that the plan that was issued, I have a date here of 2nd August for the issue of our preparedness and response plan, 2nd August 2014. So it seemed as if it took us a while to get mobilized. What would you say, in your recollection, what was the reason why the government was so slow in responding?
It didn't take us a while in terms of the response. And a lot had happened. I've shared here with you the fact that when Mr. Sawyer went to Nigeria, even the people in that cabin, at that time, contact tracing forms were available. So they had filled it. And once each of them filled the contact tracing form, it provided the opportunity to be able to reach out to them. The fact that we were able, because it could have caught us by surprise, because here was a time that we had not recorded even any case. But that preventive measure was in place. There were a lot of things that had gone on. It didn't just take one moment of brilliance, and it was very, very brilliant, of President Mahama at the UN General Assembly meeting in September. Prior to that, a lot had also gone on. For me, the overall effect of the deliberate actions that were taken was that we did not have Ebola on our shores. I think that the people out there are more interested in how they are going to cope with COVID-19.
Absolutely. And I want us to move the conversation to that.
How they are being assured that when they step out there, the state will be able to enforce the social distancing protocols that we are expecting, so that lives will not be endangered. The people who want to be assured what is the fate of their children. And here I'm looking particularly at the children in the government schools in particular. You can say that, we are providing this e-learning facility and all. Could you go to your village? How many of these children there have tablets? How many of these children there will have access to smartphones? And even if their parents will let them use theirs, how many of these parents can purchase enough data, internet bandwidth for them to be able to use for the duration of the lesson? If it's a matter of television, what is the penetration rate? We will not find it in all these homes. These are also other unintended consequences of the COVID-19 that I'm not seeing being addressed. And we hear a lot of things, but you also travel around the country, you interact with people who have all kinds of needs. And if you are not careful, children have been home for some time now, more than 2 months, and still counting. If you are not careful, we are going to widen inequality as a result of this COVID-19, because you and I and our colleagues, our children will have access to education whilst they are at home. But how about the many others who are not having it? Well-intentioned policies being trumpeted but not reaching the ground. These are critical. Again, there are a lot more people who, for instance, people with asthma, people with diabetes mellitus, people with hypertension, who are thinking, what is going to be our fate? People with HIV, people with cancer, who are already on anti-cancer drugs. What is going to be our fate? Because whenever we have heard of deaths, there is that addition of, it was because they had comorbidities. And the numbers are huge. If you take people with hypertension, diabetes, asthma, cancer, the numbers are huge.
By comorbidities, you mean pre-existing conditions?
Pre-existing conditions. So, such people also are interested in what is it that we are doing. And when I say we are doing, the entire health system, including government, to ensure that if, God forbid, they contracted COVID, they will survive. And I'll cite an example of Professor Planwu. I heard on, I think, Joy News TV that, a lot of efforts went into it, all the way to the point that the presidential jet was even flown to Kenya
to get some medication,
some drug. Oh my God. Look, at this stage, until Remdesivir became popularized in the US last week, at least, prior to Professor Jacob Planwu's demise, we knew that Atrema, that drug, tocilizumab, was good in terms of helping critically ill patients. The question is, how had we prepared for such eventualities? Because fortunately, we know that, a certain number, very few, will go into that kind of critical condition. So if you are an asthmatic out there, if you are hypertensive, if you are diabetic, if you have any cancer, you want to be assured that, we have learned our lessons, we have stock good quantity of tocilizumab, and that we are even currently looking at stocking remdesivir, so that in case you contracted it and you are more likely to be one of those who will go into critical condition, we can use the remdesivir to attack the virus itself whilst using atrema to deal with the emergency situation that is happening, which is giving you the respiratory difficulties and all. The people out there need that kind of assurance. Otherwise, you cannot quantify it. The mental health effects of this alone is massive, and it varies. Sometimes the limitations of using mortality numbers can deceive us that 18 have died. That 18, I've already said that if that is your wife, if that is your husband, if that is your child, it is 100% to you. But beyond that, beyond mortalities, there is also the concept of disability adjusted life years or years of life lost. What do I mean? This is a disease that we still do not understand its full extent. So if you don't understand its full extent, we cannot even predict the kind of complications that will be sequels of COVID-19. What example? Let's say someone has hypertension, and we all know that if your blood pressure goes up, in future you can develop stroke. So you can say that stroke was as a result of your blood pressure that was going up. We do not know the full extent of COVID-19. So we cannot even tell at this stage what kind of complications we are going to expect and how that is going to affect people's quality of life even after we have declared them as having recovered from COVID-19.
I want you to hold that thought, because we need to take a break.
We need to put all hands on deck and stock enough of the medications that are available to address the disease.
We're talking to Dr. Edward Omane Boamah. When we come back, I want to know what he thinks about all the sudden politics that emerged around the provision of district hospitals, as the president promised. Some 88 district hospitals with 6 regional hospitals. All of a sudden, it sparked some political commentary. I wonder what the good doctor thinks of that. We'll find out from him. We'll also pick his brain on a bit of politics before he leaves. Is it really true that the running mate cannot be identified?
I thought you brought me here for COVID-19.
Oh yes, because of COVID-19, we are told your party can't pick a running mate. We'll check that with Dr. Edward Omane Boamah when we return. Stay with us.
In a world where everything is changing around you, sometimes you need to turn to someone you can trust. You want to move with a change in safe hands, and we are here to help. At Societe Generale Ghana, we understand change because we have transformed and evolved. No matter how our name may change, 43 years of retail and corporate banking expertise never changes, ensuring stability and trust. Digital innovation as the world moves forward to help you adapt, upgrade, and keep up. Bank with Societe Generale Ghana and enjoy doing your banking your way, whenever you choose. In our digital zones with cutting-edge digital banking products and quality services, you deserve a better bank and great rewards. We agree, the world only moves because you make it move. SG Ghana, the future is you.
There is one deadly disease in Africa, malaria, caused by mosquitoes. It has no respect for humans, and its symptoms are fever, headache, cold, cough, and vomiting. Malaria kills, so protect yourself and your family. If you have been diagnosed of malaria, the medicine you need is Malatu. Malatu is a good anti-malaria drug. It contains artemether-lumefantrine that gives you relief from malaria. Available in suspension for kids and tablets for adults. If it's malaria, then your solution is Malatu. And if symptoms persist after 3 days, consult your physician. For bulk purchases, contact NS Chemist. NS Chemist, providing quality and affordable medicine.
The coronavirus is real. We have to take the necessary precaution and follow the safety protocols in order to stay safe and protect our loved ones. The Junction Mall, your favorite shopping and entertainment destination, has put in place the necessary safety protocols to provide a safe, secure, and serene shopping environment during this period. Please do your part as well. Wear a nose mask before you visit the center. Wash your hands with soap under running water at the hand washing facilities provided. Use the hand sanitizers provided at vantage locations in the mall. And finally, observe the social distancing protocols put in place in the various shops. We need you and your family alive for a better tomorrow. We've implemented the no mask, no entry policy at all our entrances per the government directive. Please observe the safety protocols to help reduce the spread of the virus. Stay safe, stay healthy. Follow our social media handles at The Junction GH for further details. The Junction Mall. Join, explore, shop, enjoy.
It's time for Extra. Our unlimited Airtel to go bundles now last extra long. Simply dial *111# to make unlimited Airtel to go calls for 6 whole months at just 20 Ghana cedis. To the film,
Airtel to go. Life is simple.
Dear energy consumer, the government has recently announced significant discounts in electricity bills as part of the COVID-19 mitigation. To help you enjoy your 50% discounts and make further savings on your electricity bills, kindly follow these energy conservation tips.
Use LED lights. Don't overlight your rooms and make maximum use of daylight. Make use of natural ventilation and turn on a fan only when necessary. Turn your fan on a medium or slow speed. If using AC at home, use it wisely. It is the biggest electricity consumer in your household, up to 70%. Adjust the temperature of your refrigerator to the optimum range of 5 degrees to 7 degrees and the freezers to -18 degrees.
Know what you want from the refrigerator before you open it. Don't put hot foods in fridges or freezers.
Involve your family and spread the word to your co-workers. Save energy and increase your 50% discount. This energy conservation advice was brought to you by Ministry of Energy, Energy Foundation, Energy Commission, and AGI Energy Service Center with the support of the German Development Corporation.
UMB was established in 1972 as the premier bank for the corporate and private sector in Ghana. From our very beginning, as the only Ghanaian bank serving all categories of businesses, we set a standard for excellence and innovation over the past 45 years. We've built a financially healthy and strong bank, demonstrated our commitment to our customers and to growing businesses, and exhibited originality and innovation at every turn. At UMB, our focus is built around people, service, products, and technology. These are the key to our present success and our future triumphs. At UMB, we're poised to make a difference not only with our customers, but also in the banking industry. We invite you to share in our future. Our future starts now with you.
Coffee in your cup.
studio, Dr. Edward Omane Boamah. It's been a while since we had him on the show, and we're taking full advantage of his presence, learning as much as we can, from the medical perspective on this whole COVID-19 thing. But we're also privileged because he has sat in that logistical management position as a member of the interministerial committee that dealt with Ebola. Remember back then? Yeah. Yes, a member of that committee has described him as the silent mastermind behind many of their strategies.
This is Victor Bampu.
Please, I haven't mentioned anybody's name.
This is my senior Dr. Victor Bampu.
I protect my sources.
He spread this all over.
Yes, and of course we're learning quite a lot.
Victor did a wonderful job.
Yeah,
any day I'm glad that decision was taken.
No doubt.
And you see, that should also tell us that in government, it shouldn't always be the case that someone with a higher title must occupy a particular functional role. Victor was deputy minister. His minister realized that he was engaged in several other things, ensuring deployment of massive health infrastructure and other concerns, and so he had a very competent deputy minister too. So why shouldn't he be there? I was a medical doctor, communications minister. At that time, information too had been added to the Ministry of Communications. Yeah. But I also felt that there were several other things. And again, Victor, a very competent person, so he had to be put there. I think that governments, not just governments and even organizations must learn from this shining example that the President Mahama administration adopted in terms of functionality.
Yeah. Shining example, even if you say so yourself, right? Yes, more from Dr. Edward Omane Boamah in a moment as we continue to explore Ghana's management of the COVID-19 pandemic. Today's agenda is brought to you by Societe Generale, SG Ghana. The future is you. And Malatu, anti-malarial drug from Ernest Chemist, providing quality and affordable medicine. And Absa Bank Ghana wishes to inform everyone that all of their branches are open for business. Branches in Accra, Kumasi will be open from 8:30 to 3 p.m. All other branches will operate within the normal branch hours of 8:30 to 4:30 p.m. So if you want, to remain protected during this period, then please wear your nose mask when visiting any Absa branch. Absa Bank is also encouraging you to use the Absa digital channels and enjoy secure and safe banking in the comfort of your home or office. Pay bills, buy airtime, make mobile money transfers, bank transfers, cash deposits, and so much more by using the Absa mobile app with easy and secure fingerprint and facial recognition access. Or just dial *895# to the Absa USSD phone banking, even without internet connection, or just use the Absa intelligent ATMs with cash deposit and cardless transaction functionalities. Also, remember to use your Absa debit or credit card for payment and minimize direct contact with cash. Continue to observe all the health and safety guidelines during this period. Stay safe. Absa seems to have thought about everything, haven't they? Well, look, these are not normal times, and in moments like these, we draw our loved ones closer. We discover new things and do better. Now, as you figure out how to entertain your energetic kids, collaborate on never-ending work from home, or hang out with friends together but apart, remember the most important insurance premium to ensure your family's safety is to stay home. Hollard Life Assurance will be there when you need them. Just call 0302 799 788. They've got you covered. Now, let's fight coronavirus together. If you're yet to activate your MTN Momo account, you can now do that right from the comfort of your home. Here's how you do it. Dial *170# for MTN Momo, Select your 4 digits, then re-enter your PIN to confirm. You'll receive a message confirming your activation. You can then load your Momo wallet by linking your Momo wallet to your bank account, or any agent location will do it for you. If you're yet to receive an SMS, just contact the digital channels if you need any assistance. MTN Momo is your fastest, secure, and most convenient way to transact business today. Stay safe and avoid the handling of cash. Terms and conditions apply. Just Momo it everywhere you go. We're there for you everywhere you go. All right, now I want to say a special good morning to all of you who are listening to us today. Pakwesi Barnes, avid listener, tuned in, as well as our dear friend Anita Solomon, who listens from London every single morning. She's probably doing her workout right now and listening to the Super Morning Show. Greetings to all of you who have tuned in today. Now, we'll do something rather special at the end of the show, okay? It's something we want to start doing every single day. We want to get you to review our show. Tell us what your takeaways were from the show, the big things that you learned, the one thing you're taking away from the show. So at the end of every show, we'll call one of you. We'll pick one of you from social media, we'll call you, and you can tell us in 1 minute your big takeaway from the Super Morning Show. All right? We'll be doing that with you at the end of today's show. Now, our guest is Dr. Edward Omane Boamah. We're talking COVID-19, we're talking politics, all the things that are relevant. And, Doc,
more COVID-19.
More COVID-19. I understand.
Lives matter.
All right, that's true. That's true. So let's talk about that. You know, this government has been commended internationally for some of the decisions that they've made. The president has received praise from international journalists, international leaders, for swift movement, for decisive action, for leading. I want to assess aspects of the work of this government in managing the pandemic. Let's start perhaps with the communication strategy. There have been the weekly briefings. We've had the president giving us updates on Sundays. We've had the information minister really almost on as many platforms as we'll have him, clarifying things, answering questions, having the briefings at the Ministry of Information and so forth. How do you assess this government's communication strategy on COVID-19?
Kojo, at the end of the day, communication strategy must be impactful. We are here talking about people who simply don't believe that the disease exists, and some of them are very enlightened.
Yeah,
you understand? So I would say that they need to do more. For instance, the briefings have been very Anglocentric, and it is only recently that they started introducing other local languages. They need to do more. They need to bring in Geba, and by that I mean all of you in the private media. You are doing well, but there is something that can let you dedicate more airtime to it. On your own, you are contributing. For instance, most of you ride on the back of government's digital terrestrial television network. If there can be an engagement that simply says that because of COVID-19, we are expecting this package in terms of public education in clear terms from you over this period. So even when we get to the point where you begin to have to make contributions to being on the digital terrestrial transmission platform, we are going to extend that by so and so months. That is non-cash. That immediately assures Kwesichum, assures Chief Crystal, assures Edward Boateng, now ambassador of Happy FM, and several others, that look, even if I dedicate so and so additional airtime, new and additional, I'm not talking about what you have decided to do already, new and additional airtime to COVID-19, and I lose adverts because there are some things that I have to announce on the spot. Even if I lose that, I'm going to have a gain from it in the future. So I can plan in the long term with that. That has to be done. Again, still on the private sector, the community stations, radio stations, there has to be more. And sometimes you have to hand over even recorded either CDs or pen drives to them and let them play it. ISD has challenges, but I have seen some pickups that have been branded and all, and ISD can be helped to also do more in the community because they already know the terrain and they know how they can help in these things. So that is where I take it in terms of the messages percolating to the grassroots, because even if at the level of people that we would say are elected, that you would expect to appreciate and understand the Anglocentric briefings that we have had, there are still a critical mass that are in denial. You can guess what is happening on the ground. Again, I think that government can help in terms of what they say during these briefings. And what do I mean? Without looking back unnecessarily, the announcement of the $100 million by the president. And I have said that, look, if our president could dedicate $100 million for us to fight COVID-19, then why the initial paltry 2.5 million Ghana cedis, which the World Health Organization, WHO, swiftly said the deficit was about 35 million Ghana cedis. Nothing was heard. WHO had said, look, there was a deficit of 35 million Ghana cedis. We didn't do anything about it until the disease entered, and then an announcement of $100 million. Even that, if you reconcile and triangulate the finance minister's output in Parliament with that of what the president said, it appears the president's message was a bit premature. They had not aligned the modalities very well. But you can imagine, Kojo, if just $10 million of that $100 million had been dedicated at the time that the 2.5 million Ghana cedis was assigned. Look, I remember very well, I was listening to your show or another, I don't recall the exact, and Noguchi had complained on that show that they had not seen a whisper of that 2.5 million Ghana cedis. Today, has Noguchi not become, thanks for reminding me, it was this show. Noguchi has become the cornerstone of the fight against COVID-19. But at the time that 2.5 million Ghana cedis had even been dedicated, Noguchi had been left out, had been emasculated. Kolebu Teaching Hospital also complained in that same interview. I was on my way to work. I remember very well. Kolebu Teaching Hospital had also complained. So there were serious missteps that if we had really worked on initially, because at a point, the test kits, and when I say test kits, I don't mean the kind of pregnancy test kits that we buy or diabetes test kits that we buy to check sugar and all. I'm talking about RNA extraction kits that are used for the PCR. At the time that this 2.5 million Ghana cedis was released, even if it was $10 million, which was just 10% of the $100 million which came in, you can imagine the number of test kits that Noguchi would have gathered on the market and stored. You can imagine the quantity of PPEs that we could have gotten on the market and stored, or even stimulated our local producers to manufacture them. You can imagine the quantity of masks that could have been made available until it got to a point where everybody in the world was scrambling. And then the trade wars had begun, very silent. And I believe that along the line, an academic will write about COVID-19 and trade, and it will be on the axis of the World Health Organization and the WTO, how COVID-19 has played out in terms of manufacture of products, exports and imports and all.
But let me ask
bottom
you,
line, bottom line, I'm saying that it is important that we make ourselves available to the people who elected us. But the content of what is also put out, sometimes if you are not careful, it can end up going the wrong way. One classic example has to do with the way a lot of Ghanaians, particularly on social media, responded to the president's announcement of the 88 district
hospitals. I want us to hold to that. We'll get to that in a moment.
It was in one such briefing. So I'm saying that, look, any government, would set up robust communication systems, if you have recorded this number of cases, particularly as the signs were very clear out there.
Were they though? I mean, let me ask you this, to be fair, from the very beginning.
I want us to look more at, and that has been my approach throughout this morning, to look more at what can be done. Even if we are looking at what has been done, it should be more about what can be done, because we are not out of the woods yet. We are not out of the woods yet at all. And let's spend our time more profitably on what can be done. How can we educate the people out there? You realize even when I came, the protocol that I went through, I wish this is something that can be shared. Even hand washing. We keep talking about wash your hand thoroughly with soap. How do you do it? How many people will wash their hands, and insert their fingers in between, that is the right,
interlock their fingers,
the left, and wrap them, and do the opposite, also, at the same time, go round in a rotational manner to ensure that you are really washing your hands thoroughly. I would love to see that incorporated, every morning as one of the things that will happen when they do these briefings. And there should also be a special video on it, captured slowly, explained so that people will understand. President Mahama did one and it went very viral. That should let you know how people are yearning for very practical things, simple, cost-effective, that can help us get out of the woods of COVID-19.
Let me ask you this. Do you think the NCCE is being underutilized here? They are supposed to be established across the nation in every corner, every nook and cranny. They ought to be able to get to those who need information quickly and disseminate it. But just like previous governments, they seem to be starved of resources all the time, and they are never brought on in crisis situations.
Let's state that since 1917, 1918, we've never had a pandemic of this nature. So, in emergency situations call for urgent actions. Part of the 8 billion Ghana cedis that will become available to government for the management of COVID-19. I'm still wondering why NCC is struggling. However, I will urge them to get out of the difficulty. They should partner the news outlets, the radio stations, the TV stations, if government will not resource them. I want to do that because if I sit and analyze what could have been done, it doesn't mean someone may not have died. But it is different when you've done everything that is possible, that is humanly possible, and you lose the patient. So if I look at what could have been done, particularly when we were told that a presidential jet had to be flown to look for an emergency drug and all. And in fact, sitting here, I've gotten a very vital information on the tocilizumab, and I think I don't want to put it out from here. I'll pass it on to you, and you will engage the appropriate authorities for them to do more in terms of that. So it looks as if government has a certain lethargy, a certain resistance towards spending in certain critical areas when it comes to COVID-19. But they're important. You cannot ignore NCC.
Do we not have the same problem with Ebola?
Government should make funding available to them, but whilst they wait for that needed funding, they should do more.
Right.
They should engage the private media and help to do what? To translate their messages. It shouldn't take too much to design an infographic and spread around as NCC. It shouldn't take too much to engage radio stations, community radio stations, and all as NCC.
But they have district offices whose annual disbursal is 1,000 cedis or less.
Which is why I'm saying that I'm still at sea as to why 8 billion Ghana cedis available for COVID-19.
So tell us, is there a certain reluctance sometimes on the part of government to spend money on NCC? Because the same thing happened with Ebola.
You cannot say the same thing happened with Ebola. I mean,
how much money did you spend on NCC?
Ebola was never in Ghana. COVID-19 is right here in Ghana.
Oh, by the way, 2,000. Dr. Boy says we had one case of Ebola. Is that true?
He's wrong.
Oh,
he is wrong. What was that case?
He says Tema Hospital or
Tema Hospital. And who diagnosed it?
Well, you tell us.
Was
it not true? It didn't happen?
It is not true. It is not true. Absolutely not true. Never came to the attention of anyone.
I want to quote him. He says, and I quote, according to modernghana.com, this country treated Ebola when a case was presented at the emergency unit of Tema General Hospital. So I have to tell you that my colleagues who received training...
Who confirmed it? Noguchi?
If you don't mind me, I'll just finish. I want to tell you that my colleagues who received training, just like how doctors are now receiving training for coronavirus, were able to handle this case in such a way that not even one person got infected, although we sadly lost the patient. But we pride ourselves in the fact that because of the preventive measures, nobody contracted the disease. He said this in Parliament.
Until I'm giving contrary information, credible, that it was confirmed case of Ebola, and at that time Noguchi would have been in charge because Tema falls within their jurisdiction. I would want to take it as my good friend Dr. Okoboy maybe was misquoted.
Oh, really?
Okay. I want to take it as that until I get this kind of a confirmation. And you see, sometimes you can follow up on these things. Find out from Noguchi whether they confirmed anything like that. Because symptoms can present as anything. And that is why we are also even being cautious not to assign everybody who develop symptoms and condemn them to COVID-19. Let us remember that it is a man who is predisposed, a man or woman who is predisposed to all other kinds of diseases who can still have COVID-19. And so when people are presenting with symptoms, we need to be careful, we need to confirm, and until we have confirmed, and in this case, there's no such confirmation that I have, I wouldn't want to rely on interpretation or anything. Let it be confirmed and we can all. But for now, there's nothing like that came to my attention.
So the president says a year from the beginning, the year from the beginning of construction, we will have 88 district hospitals and 6 regional hospitals. They are working out the money, and as soon as they work it out, they will start construction, and a year from that date, we'll have them. Good news?
It's great to have additional hospitals, and I situate this within the World Health Organization framework for universal health coverage, health for all. Each and every one of us must have access to health. If you look at our trajectory, President Kufuor, for instance, at the time he was mobilizing all the various district and mutual health insurance schemes into what we have. The pilots had existed, he established the district mutual health insurance schemes and all. Had expected that within a period of about 3 years, we were going to be able to attain that kind of universal coverage. Other governments that succeeded him also have worked towards ensuring that we have universal health coverage. So, ordinarily, any further step that will ensure that we have universal health coverage is great. Look, I did a paper that looked at the National Health Insurance Scheme and how it covers vulnerable populations, including people with a disability, including pregnant women and all. And you see widened vertical and horizontal inequalities in there. So if you want to look at the area of infrastructure, it is great. The question we should be asking ourselves is, how come the response to the president's announcement was that negative? And if I should engage in a hyperbole, toxic, it was as if the people simply did not want the hospital. But if you decompose the toxicity of what met the president's announcement, it was basically expressing mistrust, unbelievability, and the fact that, look, Mr. President, you've done A, B, but considering your record in the area of healthcare delivery, you have been abysmal. And so you cannot be promising us 88 district hospitals over a period of 1 year. You understand? And in addition to that, 6 regional hospitals. This means that we are looking at 94 hospitals. Look, you may want to go into construction a bit and say that, okay, we will use a prefab to do it, and then we'll bring in the equipment. And President Mahama, for instance, has alluded to other innovative financing models of getting equipment, which include leasing, franchising, and all. So with that, you don't have to put down cash or the full amount of the cash, but there are guarantees that you offer. You may want to look at all these kinds of models. But even that, if you look at the project life cycle, I was not surprised that the good people of Ghana did not take kindly to the president's announcement. And
but were they not also a bit misinformed by a bit of the NDC messaging around this? You have abandoned these projects, abandoned these projects.
I don't think, you see, once again, and you know, because I know what COVID-19 can do to humanity, and we are on school platforms, both our mates outside, not just University of Ghana Medical School, but other mates that I've had out there all over the world, and we are discussing stuff. Those in Europe are sharing very gory stories, and some of them are not doctors, some of them are epidemiologists, health policy experts, statisticians, and all. So, in this discussion, I want us to have a total picture of what is it that we can do. I think that with the president's announcement of 88, Ghanaians have roundly rejected it. I want to give Ghanaians the credit. I don't want to give the credit to NDC's politics of abandoned projects. Let's face it, the partial and I must say anemic partial activation of the University of Ghana Medical Center, it had to take a one-man demonstration. That was not instigated by the NDC. For that anemic and partial activation of the University of Ghana Medical Center to take place. In the end, it is the University of Ghana Medical Center that has become the prima donna, the cornerstone of our COVID-19 fight. You can take the Bank Hospital. Look, it could have been activated earlier, but for whatever reasons, I don't want us to go into the reasons and everything. The reasons tell negatively on our politics as a people, and we need to rise from this kind of politics and ensure that, look, whatever it is, if it is good for the country, let me get it done. It doesn't matter who gets the credit, because if you activate it, you also share in the credit. You understand? Even if credit must be given. Sometimes I even think that we overemphasize on who is taking the credit. Okay? So I think that the round rejection by sections of the country, and it was overwhelming, will let the president rethink that particular promise and maybe package it in a different way. For instance, what has President Mahama said, as far back as 2019, he has said in Bono that the 6 new regions, there was a need to provide them with 6 regional hospitals. And then his view is that, yes, the districts that don't have hospitals, it is important that they have them. But it should be a mixture of strategies. That is, you look at the population, because all districts don't have the same population. So his view is that, and he explained it thoroughly last week, his view is that if you look at the population, it may be a matter of enhancing, scaling up a polyclinic in that area to the level of a district hospital. There are other areas that may also have faith-based hospitals. And if there is a faith-based hospital there that is doing well, you can also go into that kind of PPP partnership with them, scale it up, and then that can also serve. And then where you cannot employ any of these, government can also look at physically putting in place district hospitals. I believe maybe if the president had taken his time and thought through the policy more carefully, he could have presented it that way and it would have been more acceptable than what he did. But I think that, look, the government is overworking itself in terms of the politics. And I've just received information, and I hope it's not true, that the vice president is going to engage in a program to respond to President Mohammed's thing, blah, blah. Look, that is not what Ghanaians are expecting at this stage. At this stage, Ghanaians want results.
Well, we've received no confirmation of that yet.
Okay.
We are not aware of any such.
I hope that is not the case. And please, you can confirm. And you see, I'm saying that Ghanaians will love that the vice president on this Monday morning will say that, look, we have reviewed our COVID-19 strategy. If you look at the guidelines, we think that this is the time to incorporate practically tocilizumab because it deals with interleukin-6, and interleukin-6 is destructive in the critical phase of COVID-19, and it leads to the death of many, particularly in adults. In children, it looks more like it is interleukin-1 that is doing that. So we are going to engage Roche, the people who have produced it. Roche, we are a lower middle income country. We do not have the kind of resources that the US has. So we will not be able to purchase it maybe at X dollars, but we will be able to purchase it at so and so. And we are going to mobilize Africa so that we are coming to you as all the countries of Africa so you can enhance economies of scale. So this is our plan. I would love that the vice president is coming to tell Ghanaians this. It will give me comfort that if a diabetic, if an asthmatic, if a cancer patient, if someone with hypertension got COVID-19, he will have the necessary emergency drug. The next thing can be remdesivir. That's another strategy. And there's another one which I'm also proposing that the government should also take into account. I've already spoken about the axis of the World Health Organization and the WTO. We need to start looking at the trade-related intellectual property issues that will come out of the vaccines that are being developed and also the drugs that may be developed. If we are not careful, the vaccine may be developed, the drug may be developed, and they may not be available to us, even though they are available on the market. Because if they are available on the market, they must be affordable. So what are we putting in place? As a people who do not have the resources to purchase it, so Africa must begin to come together. Let me end here. Okay. Right. So you want to bring people together, okay, so that they can begin to engage at the level of WTO. And over here, Ministry of Trade has an important role to play. If Honorable Alan Chemantin is listening, they have an important role to play. It's not more of the Ministry of Health. Ministry of Trade has an important role to play. Right. It has happened before. Sanofi had an anti-malaria drug in which they waived their patent rights and others could just even go in and produce them. So we should begin to think as Africa and begin to engage at the level of the WTO so that even if a vaccine or a drug is discovered, it will be available, not only available, but also affordable to us.
Okay, so what you're describing is pretty much what we would have got if we had allowed, for example, the Ebola vaccine trials to have happened in Ghana.
You are confusing trials with drugs. Clear confusion. What I'm talking about is an example. In South Africa, HIV, at a point, they had to go into a certain level of emergency. We are having a public health emergency with HIV, blah, blah, blah. So we cannot be purchasing the drug at this level. I'm talking about the cost of the drug. I'm not talking about solidarity trials. They are two different things.
But would a solidarity trial not also give us access to the drugs?
But don't confuse my submission.
Fair
I'm saying that
fair enough.
You are referring to solidarity trial. I'm not talking about solidarity trial. I'm talking about things like compulsory licensing, parallel importation, which are all within the TRIPS GATT framework.
All right. Thank you for that. By the way, I've got confirmation the Vice President is addressing the press corps today. But
what is the issue?
We don't know I don't have the
message I received is this: is that I mean. If it doesn't have, if it's not an official, then I'd rather we don't put it out. So I hope and pray that these are some of the issues that the Vice President is going to talk about, and not just the petty politics that we have engaged in over the years. We have a pandemic.
I'm also getting a text message that he's going to be addressing the press on what the former president said. But I'd like to have an official.
Can you imagine this on what the former president said? Is that what Ghanaians want to hear from our government at this stage?
We'll see how it unfolds. We're talking to Dr. Edward Omane Boamah, and quite a conversation. When we come back, I want to know. COVID-19 has robbed some people of their holidays. It's robbed some people of relationships. It's robbed some people of their jobs. Has it robbed John Mahama of a running mate? When we return.
What would you do if you have the choice to do anything in life? Build your dream house, take very good care of your family, and plan for a comfortable retirement. Plan a befitting funeral for your loved ones when they depart. How would you live if you knew there was a friend waiting to support you on all of your life's choices?
You have such a friend in Glyco Life Insurance. Glyco Life has all the plans to meet your life's needs. Your child's education, your life savings, your mortgage, funerals, redundancy, and your retirement, and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance plans. And remember that all our policies are hedged against inflation. Talk to Glyco Life on 0302-218-500 or 246-142. Also visit our website at www.glycolife.com or any of our branches nationwide for more information.
Glyco Life, we cushion you for life.
Glyco, we cushion you for life.
Because the greatest things are born from the smallest of thoughts. Just as your seeds in a rich soil grow to become trees that bear fruits, the Agricultural Development Bank, ADB, helps you sow, invest, nurture, and grow your personal and business plans by serving you with years of banking ingenuity and experience in agribusiness, corporate and commercial banking, consumer finance, e-banking, and many more through our network branches across the country. Whatever the culture, whatever the dream, we grow with you. Call us today on 0302-210-210 or visit www.agricbank.com. ADB, truly agric and more.
Abna, why are you crying?
Why wouldn't I cry out? This has become unbearable. Everywhere I go, I'm treated like an outcast. At home, at work, at the hospital, even at the market. Is it a crime to have TB? Is it a crime to have HIV? It's better I die. Why?
No, Abna, you can't give up and die. Indeed, a new dawn has come for persons living with HIV and those suffering from TB and sexually transmitted infections. WAPCAS, in collaboration with the Ghana AIDS Commission, is shedding light on our rights so we can enjoy equal rights as captured in the Ghana AIDS Commission Act, Act 938. Rights to quality health care, non-discrimination, equal work opportunities, and education. You may call WAPCAS on 030-224-1452 or 055-6233-663 to report any act of discrimination. WAPCAS.
Here for your rights.
WAPCAS and Act 938.
Here for life.
This advert is brought to you by WAPCAS with funding from the Global Fund.
Be happy.
Accidents do happen. It could be a motor accident, a sudden heart attack, or even a stroke, or any other health emergency. The first steps you take are very critical. Should you be involved in or witness an accident, call 112 for the fastest ambulance response. With over 300 well-equipped ambulances all over Ghana, you are assured of the fastest response to your emergency calls. Call 112 during critical health emergencies and save your life and that of your family and loved ones. 112
help will come. 112, we are safe. Avoid prank calls as they can lead to loss of life of persons in actual need of help. Be a responsible citizen.
Coffee in your cup and Joy on the set. The Super Morning Show is always the best on Joy 99.7 FM.
Has done to John Mahama's ability to pick a running mate. But before that, Ghana COVID-19 tracker is on your phone. If you're feeling unwell, if you've been in contact with persons that you're not sure might have the virus, if you're showing symptoms like fever, continuing cough, running nose, sore throat, or possibly a headache, if you're not sure what to do or who to speak to, just download the GH COVID-19 Symptom Tracker onto your phone. Access it anytime, anywhere. Dial the short code *769# on any network for assistance if you prefer. Now, your identity and information will be completely safe. Just enter the necessary details and get digital assistance. Stay home. Use the COVID-19 Symptom Tracker. Stop the spread. Save lives. Now, with over 30 years in the stationery business, Kingdom Books and Stationery continues to do wonders with their 30-day credit facility, no interest whatsoever, and they'll deliver free if you're in Accra, Tema, or surrounding towns. So call them on 0302-764-101 to find out the nearest Kingdom Books and Stationery store to where you are. You can also go to kingdomgh.com to learn more. Kingdom Books and Stationery Limited, your number one stop for all office essentials, stationery, and furniture. Thanks for all your text messages. We're going to read a few of them in a moment. Nimuizi, can you help me with that? I'd love to see a few of those messages coming through. Text messages on the Super Morning Show are brought to you by Glyco Travel Insurance Policy. Glyco, we cushion you for life. And Afrodan, your back must last you a lifetime. Good morning to our friends at Afrodan. Now, this year, 2020, turn Glyco Life into your best friend. They have 34 years proven track record of paying claims. You can get the Glyco Enhanced Life Savings Plan, the Glyco Premium and Ideal Funeral Plan, which is for funeral expenses, Glyco Critical Illness Plan, GSIP, and the Glyco Enhanced Educational Endowment Plan, GEEP, which funds educational needs of your wards. Call Glyco Life today on 45426 or 020-2222-113. So the first one is star 45426 or 020-2222-113, and they will assist you and cushion you for life. Dr. Edward Omane Boamah tells us what COVID-19 has done to his party after this.
You can't see it around you. You can't see it getting into you. You can't see it when it's in you. A big problem with the coronavirus is that you can have it and not know about it. Stay home if you feel unwell, and if you have a fever, a cough, and difficulty breathing, seek medical attention and call your local health authority immediately so they can get you help at once and see if what you can't see is the coronavirus. Do the 5 to help stop coronavirus. 1. Hands. Wash them often with soap or use sanitizer. 2. Elbow. Cough into it. 3. Face. Don't touch it. 4. Space. Keep a safe distance of 1 to 2 meters. 5. Home. Stay inside if you can. A message for your safety from the World Health Organization. If you need more information, visit www.who.int.
Alrighty then, so we're about to wrap things up with Dr. Edward Omane Boamah, and then as I promised you, one of you is going to tell us your big takeaway from the Super Morning Show. Okay, I can't wait to hear what you think went well today. What one thing you're taking away from the show. But before that, a quick message to parents and guardians. Joy Learning is intensifying teaching lessons in these times as the reported COVID-19 cases in Ghana have compelled schools to close down. Kindly tune your TV channel to Joy Learning and access their classroom lessons and other educational programs. Now listen, we can assure you that with Joy Learning, your children will not be left behind in classroom teaching while they're at home. So don't allow COVID-19 to prevent your child from learning. Joy Learning has you covered. With Joy Learning, education is secure, convenient, and easily accessible anywhere at any time in the comfort of your home. So if you get a multi-TV digibox, for your kids, that's it. You have Joy Learning and you can keep learning. Now, please don't forget to wash your hands frequently and carefully with soap and water. Rewash them several times a day, especially after touching anything, including your phone or your laptop. You can use hand sanitizers if you can't wash your hands properly. And wash fresh groceries, okay, when you buy them. Clean and disinfect surfaces like countertops, door handles, furniture, toys, laptops, and mobile phones with alcohol-based disinfectant. Make sure it's the right alcohol content, okay? So those are your COVID-19 tidbits. They're brought to you by Carex in collaboration with Ghana Medical Association. Carex kills 99% of bacteria. Say yes to life. Dole yogurt, more, I need more. Our Life soap can save your life. Use it. Magdan Shipping Company Limited, your total logistics partner. Petrosol, a delightful experience. And Hollard Life Assurance, we've got you covered. All right then, so few minutes to go, and Dr. Edward Omane Boamah is here with us. Doc.
Hi, Kudu.
Your General Secretary says that your flag bearer couldn't pick a running mate because of COVID-19. Care to elaborate?
Good. I think that judging from your alteration in your vocal cords, I can understand that you have mischief lurking.
Dr. Please do not assign motives. My question was so simple and clear. What's the answer?
Let me reference you to what President Mahama told everyone, that he's firm in his mind about who his running mate is. I believe that is the greatest assurance that anyone who is waiting for President Mahama's running mate should have. But see, there's a positive side. It means that people are excited about his ticket because they are expecting. I think that is something that has been the prerogative of presidential candidates. I remember in the year 2008, candidate Akufo-Addo named his running mate, Dr. Boamah, after April 2008. I remember very well because in April 2008, I had attended a medical conference in Yale. I returned in April, and it was after that he announced. So really, if you are looking at these things, but it's not a matter of someone's cycle. It's a matter of the fact that President Mahama has informed everybody, you and I, via a live Facebook session in which he took questions, and it was one of the questions that people asked, that he's firm in his mind about who his running mate is.
So does that mean that the COVID-19 thing is not true? The General Secretary said?
I am more interested, as we have used this program to share ideas, okay, to share with you some of the things that, let's say, President Bush considered about the selection of a running mate.
I'd love to hear that, but before that, if we could get clarity on the whole COVID-19 thing. When the General Secretary said that it's because of COVID-19 that
that's why I said
you haven't...
Judging from the alteration in your vocal cords, I was seeing mischief.
So take me out of the equation for a minute and just give our audience an answer. Give our listeners an answer.
Now I bring in the issue. And the issue is about President Mahama's selection of a running mate. And he has told you and I that he is firm in his mind who his running mate is.
Is it because of COVID-19 that he hasn't announced his decision?
I think he explained the reason why he had not announced. The most important thing is that he said clearly that he's firm in his mind who his running mate is.
So it's not because of COVID-19?
I have not said so. I'm saying that he has explained to us that he's firm in his mind who his running mate
Do you know whether it's because of COVID-19? Do you know the answer to that?
Why do I even have to link this to COVID-19? It's unnecessary.
Your General Secretary did that.
I have not heard him, and so I would...
Shall I quote him?
I mean, look,
got the report right here.
You see, that's why I said I sense that. You see, maybe you are referring to President Mohammed's reference to, even at this stage, if you named him and you want to adore and all, respecting protocols of COVID-19 and all, but that should be separated from his firmness in his mind about who his running mate is. That he has told everyone via his Facebook live sessions, in which he took questions from several Ghanaians live. I think that should be the most important thing. Running mates are important to tickets, but as President Bush once said, I believe voters base their decision on presidential candidates. You understand? That is true, but the running mate also will help support whatever efforts that the presidential candidate is going to have. In any case, the MPP doesn't have a presidential candidate, let alone a running mate. So what are we quibbling over?
Okay.
I think that we should rather get to COVID. I have few recommendations that I want to reiterate, which is the need for the preventive measures. Please, COVID-19 is real. It is not someone's imagination. It is real. And I'm saying this because I know people who are enlightened, who are behaving in ways that are risking not only their own lives, but also their families. It is real. So let's pay attention to it. Let's wash our hands thoroughly with soap and the running water. Let's use alcohol-based sanitizers. Let's ensure social distancing. Let's encourage NCC, ISD, GBC, GIBA to do more of the education. Let us also ensure some efficiency in the resources that we are using. And some of it can be pooling of the centers. Because at this stage, for instance, if we have UGMC in Accra and we have another place that is also treating, can we explore the possibility of maybe, for now, if UGMC is not full, letting all the cases go to UGMC so that we can free some other centers, if that is possible. That will minimize contamination of hospitals. Let's talk emergency drugs. Let's talk important drugs, because the trajectory still shows that we are on an upward trend. I'm also appealing that now that some new testing centers have been opened, we will be able to have real-time testing so that our graph can move from the step-ladder nature to a real-time graph that can really let us know how we are faring so that the right decisions can be taken. Above all, I think that COVID-19 does not know religion, it does not know ethnicity, it does not know your political affiliation, it does not know your profession. Let's all work together as one people bound by a common destiny and defeat the virus. The virus is the enemy.
Dr. Edward Omane Boamah, I want to thank you very much for your time with us. It's been enlightening and interesting as always. Look forward to the next one.
It's mutual.
All right then. So thank you so much for listening to the Super Morning Show. It's been a pleasure, and we're back tomorrow with even more. But stay tuned. The news team brings you the 10 o'clock bulletin. Of course, Dorinando continues with Cosmopolitan Mix right after that. Stay with your station for the duration.